Brenda Friedrich. I'm an OTA student at ACC. Can I please get your full name and date of birth?
Brett Jones, May 19th, 1945.
Okay, thank you. I'm here today to work with you on some grooming activities, and this should only take us about 20 minutes, okay? Okay, how are you feeling today? Are you having any pain at all?
Oh, a little bit of pain, yeah.
A little bit? On a scale of 0 to 10, with 0 being no pain and 10 being the most extreme pain, how would you rate your pain right now?
It's like a 2 or 3.
A 2 or 3? Okay, well, we should be okay. We're going to be sitting up as part of our activity today, but I see from your chart that you're having some blood pressure problems. So if at any time you do not feel well, please just let me know, okay?
Right.
Okay, and I may need to place my hands on you as we work together today. Would that be okay with you?
Yes.
Okay, thank you. Let me start by clearing our area, make sure it's safe for us to proceed, okay? Everything else looks clear. Okay. Well, as I said, we are going to be sitting up today to start. Are you able to sit up on your own?
Somewhat, I think I'll need some help.
Okay, no problem. I can help you with that. But remember, I need you to help me help you, okay? As we move, I'm going to start by moving your feet, then your hips, and then your shoulders. Then we're going to roll on the side, and then we'll proceed to sitting up. As I move you, I'm going to count, and it's going to sound like this. 1, 2, 3, and on 3, I'm going to move you. Do you understand? Okay. Okay, well, we'll get started. Let me just make sure your hands are positioned okay. Good. We're going to start at your feet. Okay. And on my base of support on the count of 3, I'm going to move your feet, okay?
All right.
1, 2, 3. Right, good. Okay. Now to help me, I'm going to bend your knees up to move your center of gravity forward. Okay. Next, I'm going to move your hips. Now to do this, may I place my knee on the bed, please?
Yes.
Thank you. Okay. On the count of 3, I'm going to move your hips over, okay? 1, 2, 3. Good. Okay. Lastly, I'm going to move your shoulders, and I'm going to support your head, okay? Again, I'm going to place my knee on the bed. Okay, on the count of 3, we're going to move. 1, 2, 3. Position your head. Check your extremities. Everything looks good. How are you feeling right now?
I'm fine.
You okay? Okay, we're going to move on to rolling onto your side. First, I want you to move your arm out to the side and turn your face to the right. Good. I'm also just going to place this arm this way. That's going to move your center of gravity forward. Let me go ahead and straighten this leg for you, and we're going to keep this leg bent. Okay, on the count of 3, I'm going to have my hand on your knee and on your shoulder, and we're going to turn on the count of 3, okay? All right, 1, 2, 3. Good. Are you okay?
Yes, I am.
Okay, great. The next thing we're going to do, let me start by checking your position before we sit up. Okay, on the next part, I'm going to need your help. So as I'm picking you up, you're going to be pushing off the bed using your arm as well as this hand, okay? So I'm going to start by moving your legs off of the bed, pulling them as close to me as possible. There you go. Okay, now I'm going to place one hand under your shoulder and one hand on your hip. I'm going to push down on your hip and up on your shoulder. At the same time, you're going to push off.
All right.
Okay? Okay, remember to push off on the count of 3. 1, 2, 3. Good. How are you feeling right now? Are you okay? Excuse me. You're dizzy? Go ahead and stick your arm out to the side. Slide down on your elbow slowly. Good, into sideline. Good. Okay. Let me pick your feet up. Okay. Are you okay now?
Yes.
Okay. Well, we're going to stop for today. But first, let me get you comfortable, okay?
All right.
Okay. Put your side up. Okay. I'm going to start by putting a pillow under your head. Good. Okay. Okay. Now, I'm going to place one pillow in front of your chest. Just reach around and kind of lean forward. Good. I'm also going to place a towel roll behind your back just for a little extra support. Okay. just between your knees. Good. Relax. Put this one, let me go grab one more towel, okay? Okay, are you comfortable in this position?
Yes, I am.
Okay. Well, we weren't able to do your grooming activities today, but that's okay. I'm gonna let the nurses know how you're feeling, and then I'll be back later today around 3 o'clock to check on you. Okay? Thank you for your time and participation, and I'll see you later today.
Great job, Brenda. Keep videoing. So if he were positioned in supine, how would you support?
Okay, you have a pillow under his head.
Mm-hmm.
Place his arms to the middle of his body, putting a towel roll underneath each elbow part of the arm,
Okay.
pressing into the bed. Then I put pillow under his knees and a towel roll under each foot, about at the ankle, not on the heel.
Good, okay. And then how would you move your patient up or down in bed if you needed 2 people for moving?
I would use a draw sheet.
Okay,
I would start by making sure that it was folded about the width of their shoulders to hips.
mm-hmm.
Start by rolling it loosely, place it close to the body, then going back and forth using the rail each time, pull them toward me as I work it underneath their bodies so that I have some on each side.
Okay, so if he were in sideline, like if he were positioned like this, how would you put the draw sheet right now?
Okay, I would start by going around,
Uh-huh.
putting this up, rolling him flat. Then I would put the sheet next to him, roll him on one side, or I guess I could start by putting it on this side.
Right.
I could go around this side and start, sorry, I'll start on the opposite side. And I would just set it as close as I could here.
Great.
Then I would pull him toward me, go back around and pull it back out.
Great.
Then I
Okay.
would get someone to help,
Mm-hmm.
and I would look them in the eye and instruct them exactly how we were gonna do it. We were gonna roll tightly, as close to his body as possible, keeping eye contact, giving them commands, and tell them we're gonna move the patient up from here to here, and then using good body mechanics for both of us, we would lift to the position.
And how do you know when to lift?
On the count of